Peter Propp from HealthGlobe, and I'm here with Jeff Carter. He is the CEO and co-founder of HealthGlobe. And Jeff, one of the things we're talking about today is some of the trends that are going on in corporate medical travel. I know you've had some interesting discussions lately in a type of narrowcasting around corporate medical travel. And let's you and I try to figure out a better phrase for that. As corporations, institutions who are already doing self-insurance of some sort are figuring out ways to insert a corporate medical benefit into their plan, right?
Yeah, it's an interesting question, actually, Peter. One of the things that we're hearing more and more now is, taking a broad-based approach to medical travel is a little bit almost destabilizing for people who are participants in the plan, because they really worry that it's not about quality, it's about cost, and what are the changes that are being made to the plan. Sometimes they have trouble understanding why it makes such a broad-based change to a plan. So one of the questions that we're kind of getting points of interest a lot now is, how can we help to address a very specific target area for a given plan? So let me give you an example. We're working actually with a hospital right now that has a self-funded benefit plan, and they've had some very high claims for bariatric surgeries over the last couple of years. So what they asked us to do was, instead of doing a broad-based medical travel benefit like we typically do, number one, obviously it's a hospital, so they like to keep their folks domestic,
Sure.
Which obviously, we have a very solid domestic network. And number two, they wanted to limit the benefit only to bariatric procedures. So we worked with them on that, and we have set up a very narrow, focused bariatric benefit specifically delivered through our partner Blossom Bariatrics in Las Vegas. We brought the HR director for the hospital out there, met with the docs, met with the staff, and they were very happy. So they're moving forward with the implementation process right now. So it's an example of, instead of trying to be everything to everyone, kind of trying to really focus in on a problem, a specific issue, and come up with a creative solution that really arguably increases quality and still decreases cost very, very significantly.
Right. The phrase I just wrote down, and you just used the word also, is focus medical travel solutions, something like that, right? Where you're really trying to solve a specific problem that's causing a specific issue, and we're all counting so much more these days, right? As a marketer, I count every link and hit on a website. As a medical benefits administrator, obviously the numbers are much more significant, and each incidence of a need for medical care can be hugely expensive. So if they're tracking those high ticket items and seeing a pattern, they really need to look at it.
Well, and what you want and what you count and how you count it is really important.
Right.
So it's easy to count dollars. Everybody does that.
Sure.
But especially when you're, when as an HR person, you have kind of a dual mandate. You have to keep costs down, but you're supposed to be looking out for the employees, and so you also want to count outcomes. What are the outcomes like at the providers that you're using? And so I think counting quality is just as important as counting dollars. And in this particular case, we were able to increase the quality, which is the direction in which you want it to go. It keeps health and wellness of your employees improved over time.
Right.
But we're also able to decrease the cost. So it really is a win-win type of situation.
Right. So and in this situation, the patient is traveling from New Hampshire to Las Vegas. Is that right? For the care?
Correct.
And so what sort of a deal has been structured between the employer, the hospital in New Hampshire, and the supplier in Las Vegas? Do they get a set price per bariatric procedure?
No, health is kind of individualized, so
Sure.
Every case is a little bit different.
Yep.
But on average, the costs are significantly lower. The what we call it is a reference price, right? Like for for a standard textbook case, this is the rate.
Mm-hmm.
But every rate is a little bit different
Sure.
depending on the person's individual condition.
Right. And so if these individuals, they're New Hampshire, their major medical center locally would be Boston, which is a very high price place to get anything done.
Exactly.
The excellent doctors in Boston, but really expensive care.
Definitely.
So this hospital in New Hampshire, obviously they're attuned to the price of medical care. Boston didn't seem like the right fit for them. They didn't want to do it themselves in terms of quality, and so they've chosen to go to a facility that has great quality, but can also give them a much better price point.
That's right.
Right, interesting. And do they have any patients lined up to go at this point, or are they? That's
They haven't even actually fully implemented the benefit yet.
I see.
We're still working through the implementation process.
But and for them, do they look at actuarial tables to figure out how often they're using bariatric as a procedure? Or
we're way off script now. I have no idea.
Yeah. But they identified it as a procedure that was coming up on a regular basis.
Yeah, their consultant. We work with their consultant, so
Mm-hmm.
I'm not sure exactly what machinations that they went through to decide that they wanted to target that.
Interesting. Well, that's very cool. So it's a focused medical travel solution that allows an employer to look at quality care, cost control, and employee retention, really, because if you're providing good care and you're taking care of your employees, retention is one of the benefits you're going to get as well.
Absolutely.
Excellent. Well, Jeff, I think we've covered this topic pretty well, and probably have taken up more than enough time on this one. Thanks so much for taking the time to talk today, and I know we're going to do these on a regular basis. So for HealthGlobe, this is Peter Propp signing off. Thanks, Jeff.
I'm going to be looking forward to it. Bye.
All right. Take care. Bye.